Hello everyone. During this pandemic, are you suffering from a neck pain or a back pain at the end of the day after a prolonged sitting hours or a continuous use of gadgets or maybe due to the long household chores? Or someone who thought of going for a walk after months and ended up suffering calf pain? At this particular situation, the common question which arises is to apply ice pack or a hot pack for immediate relief. So today, here I am, Mrs. Dr. Isha Shah, a physiotherapist practicing since 8 years to help you out with a better understanding about the mechanism, the factors to be considered in various conditions during application of ice pack and hot pack. In this video, I'll be covering ice packs, uses and contraindications. So first use among many is to decrease inflammation. Now, what is inflammation? Whenever we come across any form of injury or a slight cut or we have a fall, our body starts reacting by increasing the blood flow at that particular site in the form of self-healing. Hence, we develop swelling, redness, warmth at that particular site. By applying cold pack, what happens is the blood vessel constricts or narrows down. Hence, the blood flow decreases. Thus, the nutrients present at that particular site is absorbed more efficiently, hence promotes faster healing. Inflammation is divided into 3 stages: acute, subacute and chronic. Acute is termed immediately after the injury up to 3 days. Chronic is termed when the symptoms or the effects persist for more than 3 months. Now, during acute stage, application of ice for 15 to 20 minutes continuously. Keep moving, keep checking, don't end up into the ice burn. Do not apply more than 15 to 20 minutes, nor less. Apply twice or thrice a day for a good result. Now, the second use is post-surgeries. Knee replacements or tendon transfers. It's proved to be very beneficial. What happens after surgery is due to the staples, stitches or any foreign bodies which is imparted inside, there are chances of internal bleeding, thus leading to infection. Application of ice prevents infection, hence decreases swelling, tenderness, stiffness, increases tissue extensibility and thus increasing range of motion at that particular joint, which will further help in faster recovery. The third application is in stroke patients. In paralysis, the impulses from brain to muscle is decreased, and thus in the recovery stage, one group of muscle would end up into spasticity, and thus the functional movement is absent or decreases. By applying ice, the signal to the brain nerve impulse increases and hence the spasticity decreases, which helps in further functional recovery. But in this patient's application of ice is quite tricky. You need to consider the speed, the direction and the group of muscle to be applied. Also, ice packs are beneficial to decrease muscle soreness post exercises. Now, let's quickly go through the contraindications. First is open wounds. Second if you are hypersensitive or insensitive to cold. Third, in case you have a hypertension or patient is suffering from severe blood pressure, it's no. Fourth, if you have a decreased or impaired sensations at that particular site, maybe because of the high sugar or peripheral vascular diseases or neuropathies or DVT, any of the reasons, but the application of ice is no in impaired sensations. I hope this video was helpful, and if you liked it or it can be of help to any of your friends or relatives, please do like and share the video. Take care.